CT scan is an X-ray procedure that combines many X-ray images with the aid of a computer to generate cross-sectional views and, if needed, three-dimensional images of the internal organs and structures of the body. CT is more commonly known by its abbreviated name CT scan or CAT scan. A CT scan is used to define normal and abnormal structures in the body and/or assist in procedures by helping to accurately guide the placement of its instruments or treatments. When you arrive, our counselor will greet you and make sure you have all your information and basic questions to answer. In preparation for a CT scan, patients are often asked to avoid food, especially when the contrast material is to be used. Contrast material may be injected intravenously or administered by mouth or by an enema in order to increase the distinction between various organs or areas of the body. Therefore, fluids and food may be restricted for several hours prior to the examination. If the patient has history of allergy to contrast materials such as iodine, the requesting physician and radiology staff should be notified. A CT specialist will greet you and bring you to the exam area. These technologies is completed a regular course of education, training, and works under close supervision of the radiologist to assure the most accurately result from your examination prior to the start of the CT exam. The technologist will explain the procedure to you and address any concern you may have. Let your CT tech know if you are pregnant or think you may be pregnant. All metallic materials and certain clothing around the body are removed because they can interfere with the clarity of the image. Will be gently position the patient and secure on the scan table. The table is slipped into the center of the large donut-shaped machine which takes the X-ray images around the body. The actual procedure can take from half an hour to an hour and a half. If specific tests, biopsies, or interventions are performed by the radiologist during the CT scanning, additional time and monitoring may be required. It is important during the CT scan procedure that the patient minimizes any body movement by remaining as still and quiet as is possible. This significantly increases the clarity of the X-ray images. The CT scan technologist tells the patients when to breathe or hold his or her breath during scans of the chest and abdomen. If any problems are experienced during the CT scan, the technologist should be informed immediately. The technologist directly watches the patient through an observation window during the procedure, and there is an intercom system in the room for added patient safety. After the procedure, your examination will be read and interpreted by one of our board-certified radiologists who specializes in CT.